Good afternoon, everyone. My name is Simran Chaudhary, and I welcome you all on behalf of Voice of Healthcare to our fourth edition of Not Just a Dog, honoring hope in healing, recognizing the caregivers to celebrate National Doctors Day. As we all know, this month we are celebrating National Doctors Day, and today to celebrate this day, we have with us Dr. Unnikuttan D, Consultant Orthopedics at SUT Pattom Hospital. Welcome to our show, sir.
Thank you.
So this year we are celebrating the fourth edition of Not Just a Dog, which is an extraordinary celebration dedicated to showcasing the remarkable efforts of our doctors and expressing our heartfelt appreciation for their selfless service. And with this initiative, we want to focus the person behind this profession, who exactly it is, what are their dislikings and likings, and what do they enjoy most. So, without wasting any time, I would like to know those things from you, sir. So, my first question is, so what inspired you to pursue a career in medicine, and how do you balance your professional life with your personal interest and hobbies?
Rather, like every person pursuing a career at that during that period, like every 90s kid, rather, I would say, I was also definitely influenced by the then trend, that is medicine, engineering, or civil service. I was not a person who was much interested in general studies, so engineering and medical profession was the two options that came to me. And out of the two, I always felt like a medical profession is something which demands application of science at its root level, because every patient is different, every disease is different, and every disease is different in every patient. So naturally, we will be forced to use the basic plus two level physics, biology, mathematics, and of course not mathematics, the physics, chemistry, and biology in every patient. So rather, I felt like it is much more or less monotonous, and hence that could be the reason I chose medicine compared to engineering. And as I passed through my 10th year of career, I feel like that is rather correct.
And so, how do you balance your personal and professional life?
Uh, of course, as a surgeon, it is very difficult but we'll have to strike a balance. So I always make sure that I spend equal time with my family as well as my patients.
That's great. So I know that that is difficult, and to take out that time is more difficult. But
Yeah.
moving on, how do you unwind after a long day at work when you go home or you go out to give yourself that me time? And what do you enjoy most about your downtime activities?
Of course, I do some sports, like I like cricket, playing cricket, and I do reading. I write a bit. I do some column writing and all. But I'm not like any other professional. I am not a master in any of this. But if you specifically ask me what I do when I get a free time, I would rather like to sit idle. I would like to idle a bit, just sitting relaxed on an easy chair without doing anything is the best thing I would like to do after a busy day or something like that. Because idling, I always felt like idling for a while, like a few hours, will instill new inspirations, new thoughts, and usually it end up doing something new in a creative manner, like planning a new travel, etc., or writing something or something like that.
We can understand, sir, that that sitting alone time gives you that space to reorganize your thoughts, to analyze what has happened, and to think beyond that, what else we can do to relax and to
Yeah,
do more, to
exactly.
be more productive.
Yeah, for every person, it should be like that. For
So,
what I felt.
so, and according to you, what advice would you give to the fellow doctors about pursuing passion outside their profession? Why do you think it is important, and why should they do this?
I am not that a senior a person to advise my colleagues, but rather I would tell something which I always want to tell myself. I always advise myself, like career is only a part of life. Um, don't make it a running race for a 2020 cricket. It's a long process, like a test cricket or a long marathon. We have enough time for ups and downs. We should make sure that we don't forget to enjoy many other little and big things in life while pacing forward.
That's great, sir. And I think what we realize first for ourselves is the actual natural true advice which we we feel that a junior should follow that and they should understand at early age. So
Yeah.
lastly, what do you enjoy most about interacting with your patients at personal level? And how does this enhance your medical practice as interacting with your patients, dealing with them is your daily activity, main routine? So how does it benefit you?
Professionally, I don't think it is not very wise to get into the personal aspects of a patient or any customer in any business or any job would be. But often, as doctors, we will have to chat a bit with the patient because it is important to develop a rapport with them to explain things better. For example, we will have to explain them the nature of their illness, the treatment plan, and the prognosis often, etc. These things has to be explained to them, which I always felt that it is conveyed better if we can spend some extra time on their personal things, or at least some topics which both the patient as well as the doctor is interested in. We can talk a bit extra, of course, and into their personal things, like things can be done. This definitely enhance the rapport, and hence can uh, improve our treatment, because explaining things is the most difficult thing as far as the medical practice is concerned.
I can totally understand, sir. But the patient should understand doctor, and doctor should understand patient. That's how the communication and trust will build, and that is the most important job to gain that trust. And I know all the doctors are doing this great work with a lot of enthusiasm, energy, and wholeheartedly. That's why we trust our doctors, and we always come to you to save us, to guide us for betterment of our health. And that way, I would like to thank you and all the doctors of our industry for being there, for being there for our patients and making our life better. Thanks a lot, sir. Thanks a lot for taking out time for this interview, and wish you a happy Doctors Day again.
Thank you, Simran. Thank you
Thanks a
again.
lot.